But yeah, we really appreciate Bill, and we really appreciate you guys coming in, getting some CEs the old-fashioned way. I mean, we're going to do a lot of hands-on here. So this is just me goofing around up here for the first 15 minutes or so, and we're going to get everybody up. We're going to make a bunch of masks and kind of show you what this system can do kind of for your total body immobilization. So this is called a three-tiered approach to total body immobilization. So basically the three-tiered approach is the rotating couch top, and then we put our all-in-one system on here with the extremity system. So the reason for with the extremity system is if you're trying to treat the whole body without moving it, it's kind of nice to know where the legs are when you flip the patient around. So if you don't have the lower extremities, it's kind of like the leg could be here, the leg could be here, so it keeps them in the same position the whole time. But I'll just introduce myself real quick. I have more than 12 years of radiation therapy experience. Started off at UFPTI, got some members in the house. What's up, y'all? Really good place to start my career. I started in protons, kind of stayed in protons, left UFPTI, went down to Texas, put my cowboy hat on, and we opened the center in Texas, the Proton Center. So it was really cool to open that from the ground up and just make all the decisions from the ground up. So then I'm from Nashville, so I went back to Nashville to the Proton Center in Nashville, and I was the manager there. So I got to build another Proton Center from the ground up, which was a really cool experience. And then I got fortunate enough to get picked up by Orfit around COVID. So got to leave the clinic during COVID and come over to Orfit, which was really, really nice. But I also have a baby named Reggie. Here he is. He's a happy boy. We just like to do a little personal stuff there. But let's get into the actual stuff now. So this is the workshop objectives. We're going to discuss how to achieve better reproducibility for whole body immobilization without having to reset the patient between isocenters. So that's a big deal, and we'll get more into that later on. But we learn how to mold different types of masks for the entire body. So as you can see, we go from head to foot here, and it's very important when you're talking about whole body immobilization. If you're trying to kind of achieve reproducibility, it's nice to have all the different types of masks and compare the different thermoplastics involved in the setups and be able to adapt the system for all sizes of patient. So I'll show you, we had somebody test us for the extreme size of a patient, and it fit really well. So of course, most of this is going to be hands-on. So after I get done rambling up here, we'll get everybody up here and we'll make a bunch of masks. So I want to ask, how many people are doing total body mobilization? Couple? Here? Here, don't be shy. I know some of you are out there. So how do you guys do it? How do you immobilize the patient's whole body?
Full body back.
Full body back lock. So that's a pretty popular one we've heard a lot. And what full body back lock? I saw some hands. Full body back lock.
Anyone
That's it.
doing the standing?
No standing with the thing.
Nice.
None of that. Okay. Yeah, we had a lot of people doing the stand and all kinds of crazy setups. But this is kind of what I found online, and I've worked with some of these. So we had this at Vanderbilt, and it's kind of like the little climbing harness. This one is a lot of these patients are really sick, so they can't really stand and do this. And so that's what we really think is beneficial, to lay them supine. Another one is this one right here. So another thing when people are doing this VMAT is you don't have to use these lung blocks anymore. So the lung blocks are like not super accurate. You have to take a film, do the custom lung blocks. And like I was talking to somebody before, like when you take the image, you're not really treating that image because the patient's moving in between image and treatment. So it's really nice to not have to use those, not have to fiddle with those. This is my personal favorite. I like this guy's face right here. It kind of looks like he's in a microscope, like they put him in between these two little glass things and put him there. But let's get into why we need to mobilize the whole body. Like, what's the point? Like, what are we treating? TBI, treatments for bone marrow transplants. And I think the nomenclature has changed to TMI, total marrow irradiation. So I'm a little behind there. Treatment for leukemia and lymphoma, but these treatments, when they do the bone marrow transplants, are super successful. So like the radiation that we're doing is directly saving these patients' lives. So the radiation they get is like the first step of getting healed. So another thing is to reduce the graft versus host disease. So if someone's getting some sort of transplant, we need to knock their immune system down. Or palliative care and distant metastases. So we're also talking like, what if you had a lung patient that had distant met like down in the lower extremity? So if that patient is in a lot of pain, it takes a really long time. So if you have to put them down and get them off the table and they think they're done, they don't want to get back on the table. They're done. So it's nice to just turn them around and treat the other ISO. So why change the immobilization? So why would we go away from these full body back locks and go to what we're doing now? So it's easier for the patient. So these patients can be very sick, like I said, and supine is easier for them. Quicker setup time. So with this rotating couch top, you can, without having to get the patient up and it's almost like you're treating two patients in one treatment slot. So it can knock off 30 minutes, sometimes 45 minutes, depending on what you got going on the table. Better for planning purposes. So if you use VMAT for your TMIs or TBIs, you can spare the lungs a lot better, like I was saying, without having to use those ambiguous lung blocks where you're just kind of putting them anywhere. And I read on a paper that 25% of TBI patients get radiation-induced interstitial pneumonitis, and that can be deadly to these patients because of their immune system. So if we can do the patient a better service of doing the VMAT, why not do that? So this is what I was talking about. So we were at the University of Arkansas showing them this. And, every time we show them a different product, they're like, okay, I have somebody that's going to break the whole system. So they brought this guy in. He's a therapist at their site. He's 6'5", and they didn't think he was going to fit on this board. And when he walked through the door and ducked under the door, I didn't think he was going to fit either. So we put him on here, and he fit perfect. And this is kind of how a lot of people immobilize the arms too. Sometimes they put them up here, so within the mask, so you have everything nice and tight. But yeah, I was kind of surprised that he fit on there. He was a huge guy. This is Scott at, where are you at with this one, Scott?
AAPM.
Scott, this is Scott at AAPM, just kind of showing how easy it is to rotate. And we'll get you guys up here and you'll be able to rotate it as well. And then I borrowed the slide from our friends at NYU. So they did a VMAT presentation a couple of years ago on TBI, and this is kind of how the beam arrangement would be. So you have like 4 to 5 ISOs at up top for your VMAT, and then once you get down to the lower past the waist, you can do like APPA for the legs. So that's what I was saying. Like when you have these foot masks, you know where the legs are, so the patient's not moved them or picked them up or moved them. So you're saving your spot every time. So that's what the beam arrangement kind of looks like. Here's a little video of our crew in Belgium in a clinic, just showing you how easy it is to rotate it. So it's essentially like a lazy Susan, just rotates around, and you can rotate it very easily. Okay, and I am done. I know you guys are glad I'm done talking up here. We're going to get you up here. Lynette's going to come over here, and we're going to make some masks on her. So we were a little tight on time on the last group, so we're going to go row by row here and try to get you up here for 5 or 6 minutes, okay?